today I will be presenting on the topic of family planning and reproductive options for those with Lynch syndrome. And before we begin, one thing I think is important to mention is that many people decide after hearing this information that they're comfortable with not really doing anything differently in terms of family planning. And I just want to say up front that that is completely okay as well. Some people, based on their experiences with Lynch syndrome, may feel strongly that they would like to take steps to reduce the likelihood of cancer in the next generation. So the goal of this presentation is really just to give you more information about options that are available to you so that you can make an informed decision for yourself and your family. So some of the common questions that we hear in genetics and genetic counseling I've put some of these on the screen for us. I hear a lot, what are my chances to have a child with Lynch syndrome, or a more rare childhood cancer predisposition syndrome called CMRD, which we'll discuss more in detail. People also ask what options are available for family planning, especially if they are an individual who are undergoing cancer treatment that may impact fertility, or if they are someone who has undergone a prophylactic surgery such as removal of the uterus. Another thing we're going to touch on is what options are available for assisted reproductive technology, including IVF, and testing, genetic testing as part of IVF. We're also going to get into the cost of those procedures. And then there are also people who know that they're not interested in assisted reproductive technology or ART, but they're curious to learn what other options are available to them. So within the time I've been allotted, I will touch on as much of that as we possibly can. So I wanted to briefly just review the chances for someone who has Lynch syndrome to have a child who is affected. So as many of you are probably aware, with each pregnancy, there is a 50% chance to have Lynch syndrome in a child, and a 50% chance to have an unaffected child. And of course, that is the case for each pregnancy, independent of the other pregnancies. For couples who both have Lynch syndrome, the chance to have a child with Lynch syndrome really depends on if they have, meaning the parents have the same type of Lynch syndrome, or if they have Lynch syndrome related to different genes. So for individuals who have different types of Lynch syndrome, there is a 75% chance that each pregnancy will be affected with Lynch syndrome, whether that is because they inherited it from their mom, their dad, or sometimes both. And for couples who have the same type of Lynch syndrome, there's a 50% chance for each pregnancy to have Lynch syndrome, a 25% chance for them to have this condition called CMRD, which we will discuss in more detail in a minute here, and then also a 25% chance to have an unaffected child. So for those of you who are unaware or haven't heard this information recently, CMRD stands for Constitutional Mismatch Repair Deficiency. And this is a condition that occurs only when both parents have Lynch syndrome caused by mutations in the same gene. For example, both parents have an MLH1 mutation, and if the child inherits both of those mutations. So as we discussed in the last slide, there would be a 25% chance with each pregnancy that that couple conceives. And CMMRD is something we talk about in genetic counseling because it increases the risk for many types of cancer, but including childhood cancers, which we don't see as much with Lynch syndrome by itself. So cancers that can be seen before age 18 in CMMRD include certain brain tumors, and also leukemias and lymphomas, which are hematologic or blood cancers. We also may see areas of darker skin pigmentation in people with CMMRD called cafe au lait spots. And of course, because it is technically Lynch syndrome, we do see an increased risk for cancers of the colon, small intestine, urinary tract, uterus, and other organs that we see in Lynch syndrome as well. And these may occur at younger ages. I wanted to just go through the chances for two partners with the same type of Lynch syndrome to have a child with CMMRD. As we discussed, if we know that both partners have Lynch syndrome, that's going to be a 1 in 4 or a 25% chance. But what if we don't know whether or not the other partner has Lynch syndrome? In this case, the chance varies depending on what type of Lynch syndrome the first parent has. And we know in that case that regardless of which gene is involved, the chance for them to have a child with CMMRD is always going to be less than 1%. But if we know that the partner who has not had testing has a family history of, let's say, colon cancer, endometrial cancer, or other cancers that we see commonly in Lynch syndrome, it's definitely a good idea to offer genetic testing for the other partner to see if they may have Lynch syndrome, and if so, what gene is involved. So there are several different reproductive options available to individuals and families with Lynch syndrome, and we will have time to just discuss a few of those today, but I wanted to provide this list of some of these options. So for people who are aware that they have Lynch syndrome early in life, some people choose to have children prior to prophylactic surgical removal of the uterus, fallopian tubes, and sometimes the ovaries. If we have this information in time and the situation is right, some people are able to have children prior to making those surgical decisions. In addition, we also consider the option for cryopreservation, which I'll talk a little bit more about before beginning cancer treatment. So that involves freezing the eggs or the sperm cells so that they can be used if fertility is lost or reduced during cancer treatment. We also can discuss the option with patients if they would be interested in using donor gametes, which are just egg or sperm cells, or even the option for surrogacy in some individuals. There's also, of course, options for adoption, and we can, as I discussed a little bit before, talk a little bit more about options for IVF during pregnancy, which is an assisted reproductive technology. And of course, I wanted to throw in there that there's also the option to not really make any major changes and just let children decide to get tested once they're 18 or older. I don't know how I made that mark on the screen. I'll just leave it there. So when we talk about fertility preservation, the main situation when this comes up is if an individual is diagnosed with cancer that requires a treatment during their reproductive years, thank you for removing that, which may decrease their fertility as part of cancer treatment. So some patients choose to freeze their eggs or sperm via this process of cryopreservation for future use. So following cryopreservation, the eggs or sperm can be used to create an embryo, which can then be implanted into the uterus of either the mother or a surrogate using the process called in vitro fertilization. And the IVF process can be accompanied by a type of genetic testing called pre-implantation genetic testing, which is used to implant embryos that do not have Lynch syndrome. I also wanted to just mention that IVF and this pre-implantation genetic testing called PGT-M are also available to those who have not needed to use cryopreservation as well. And it's used by many people outside of the Lynch syndrome world. So here's a diagram of showing the general process of IVF. So as you can see, it begins with the retrieval of both the egg and the sperm cell, which are then used to grow embryos. And then they take a small biopsy of a developing embryo and perform genetic testing for Lynch syndrome on that embryo. And then from there, they implant a single or sometimes multiple embryos into the uterus and use cryopreservation, again, to preserve the rest if needed. I wanted to just touch on some of the considerations that many people talk about with regard to IVF. Many patients typically see a success rate of about 20 to 35% per cycle, and that unfortunately does not add upon itself with each successive cycle. So we found that the cumulative effectiveness of 3 cycles of IVF increases the chance of a successful pregnancy to about 45 to 53%. And overall, if you know anyone who has had IVF or if you've undergone it yourself, you know that cost is absolutely a factor. And unfortunately, this can be prohibited for many families, even if they are interested. So I wanted to talk a little bit about what those costs look like as well. The national average for the IVF procedure alone without PGT-M, or that genetic testing that we can add to IVF, is between 10 and 16,000 per cycle. The PGT-M, the genetic testing, typically adds between 6,000 to 12,000 also per cycle. And there can be additional costs for medication and other procedures that are not included in those totals. So altogether, the total national average cost is between 22,000 and 42,000. I'm including some numbers that we have quoted patients locally in Utah. Typically, per cycle of the main components of the IVF process, people pay a little bit less than $11,000. And then I've listed some of those additional fees that we typically see patients report. So the medication costs, as I mentioned earlier, are typically an additional $4,000 to $8,000, typically paid directly to the pharmacy as well. And then there's a separate fee for the transfer of the embryo into the uterus, and ultrasounds and other imaging that are involved as well. So the total cost on average that we've seen here is between $21,000 and $29,000. And again, that is per cycle. So currently, health insurance providers are not required to cover assisted reproductive technologies such as IVF and PGT-M. And this is a question I get most frequently with patients who are considering these options for themselves and their family. But with that being said, some insurance companies and employers actually offer partial coverage or reimbursement. So it might be worth it, if this is something that you're interested in, to speak with a representative from your insurance company and or a human resources rep from your company to learn more specifically about your policy benefits and if there are opportunities for at least reimbursement from your company. And also, many reproductive medicine clinics in the area that I've worked with have offered payment plans to their patients. So while they still have to pay the full amount, they sometimes offer to have the patient pay it in increments, which can be helpful to some families. So there are some other options that I definitely want to mention if IVF or pre-implantation genetic testing is not something that you're interested in. I get asked a lot if we can test a pregnancy for Lynch syndrome. And the answer to that is that it's typically not recommended unless the patient would elect to terminate the pregnancy based on this information. Some families do choose this option, but it's definitely not something that's for everyone. If a child is at a 25% risk for the condition called CMRD, however, we will offer testing either during pregnancy or early childhood, as of course this condition is associated with those childhood cancer risks that we talked about. The other option is, of course, to just wait until the child is over age 18 to test for Lynch syndrome in order to preserve their autonomy and allow them to make that decision when it's right for them. I did include some information for some local Utah reproductive medicine clinics. So we do have one here in Salt Lake, as well as in Sandy, Provo, and Pleasant Grove. So if you would like to take down this information and contact them, they could definitely be helpful in determining a little bit more specifically what those costs look like at their center and what options they have available. And that was all I had to present. Thank you so much for your time and attention, and I'm happy to answer any questions I can.